Hello, incredible seniors and devoted caregivers. Welcome back to our YouTube channel, your trusted sanctuary for practical, uplifting, and comprehensive health insights crafted especially for the golden years. Today, we're diving deep into a topic that touches millions worldwide: hepatitis B and C, viral infections that quietly target the liver, threatening its vital role in detoxification, metabolism, and energy production. For seniors, these viruses can be particularly insidious, as age-related immune decline makes it harder to fight infections, potentially leading to severe complications like cirrhosis or liver cancer if left untreated. These conditions can transform cherished moments, sharing family meals, gardening, reading with grandchildren, or simply enjoying a restful evening, into challenges marked by fatigue, jaundice, or discomfort. But don't lose hope. With early detection, modern treatments, lifestyle changes, and a supportive community, you can manage hepatitis B and C effectively, protect your liver, and continue to lead a vibrant, fulfilling life well into your golden years. In this in-depth video, we'll embark on a comprehensive journey through hepatitis B and C. We'll define what these infections are and why they're critical for seniors, explore their causes and risk factors with detailed explanations, outline symptoms to help you spot signs early, explain diagnostic methods with step-by-step clarity, present a wide array of treatment options including antiviral therapies, natural remedies, and preventive measures, provide a detailed 7-day meal plan with senior-friendly recipes to nourish your liver, share inspiring real-life stories of resilience and triumph, offer expert advice from leading hepatologists and geriatricians, highlight an extensive network of community resources for ongoing support, discuss essential precautions to ensure safety and prevent transmission, uncover the profound psychological and social benefits of managing these conditions, examine their significant impact on daily living with relatable examples, emphasize the indispensable role of caregivers with actionable tips, and conclude with a motivating call to action to empower you to take control of your liver health today. Our goal is to make this content engaging, accessible, and overflowing with practical steps, because health in your later years is about thriving with vitality, not just managing silent threats. So, grab a warm cup of green tea, a refreshing glass of water, or your favorite cozy blanket. Find a comfortable spot, and let's dive into this enlightening adventure together. Ready? Let's get started. What are hepatitis B and C, and why do they matter for seniors? Hepatitis B and C are viral infections caused by the hepatitis B virus, HBV, and hepatitis C virus, HCV, respectively, which primarily attack the liver, an organ that acts as the body's powerhouse, detoxifying blood, metabolizing nutrients, producing bile for digestion, and regulating hormones like insulin. HBV, a double-stranded DNA virus from the Hepatnaviridae family, spreads through blood, semen, vaginal fluids, or from mother to child during birth. HCV, a single-stranded RNA virus from the Flaviviridae family, is transmitted mainly through blood exposure. Both can cause acute infections, lasting less than 6 months, or chronic infections, persisting beyond 6 months, with chronic forms posing the greatest risk for severe liver damage. For seniors, hepatitis B and C are critical health concerns due to the aging immune system's reduced ability to combat infections. According to the World Health Organization, WHO 2023, over 296 million people globally live with chronic hepatitis B and 58 million with chronic hepatitis C, with adults over 60 accounting for 40 of advanced liver disease cases due to delayed diagnosis and cumulative damage over decades. In the United States, the Centers for Disease Control and Prevention, CDC 2023, estimates that 2.4 million people have chronic hepatitis C and 850,000 have chronic hepatitis B, with seniors facing a higher risk of complications like cirrhosis, affecting 20 to 30% of chronic cases, or hepatocellular carcinoma, liver cancer, which carries a 5 to 10% lifetime risk if untreated. The American Liver Foundation, 2023, notes that seniors are often diagnosed late, as symptoms mimic aging complaints, delaying treatment, and increasing mortality risk by 25%. Why does this matter? Untreated hepatitis B or C can lead to a cascade of complications that erode quality of life. Cirrhosis, scarring of the liver, impairs its function, causing fluid buildup, ascites, portal hypertension, and a 30% risk of liver failure within 5 to 10 years. Journal of Hepatology, 2021. Liver cancer, with a 5-year survival rate of just 18%. American Cancer Society, 2023, is a devastating outcome that can rob seniors of independence, isolate them from social circles due to fatigue or stigma, and diminish the joy of hobbies like gardening, traveling, or family gatherings. However, with proactive screening, antiviral therapies, vaccinations for HBV, and lifestyle adjustments, seniors can halt progression, protect their liver, and thrive. Let's explore the causes and risk factors driving these infections. Causes and risk factors of hepatitis B and C. What puts seniors at risk? Hepatitis B and C are caused by specific viruses, but their spread and severity are influenced by a complex interplay of behavioral, environmental, and physiological factors, particularly in seniors. Understanding these risks empowers you to take preventive steps and seek timely care. Let's break it down in detail. Primary causes: hepatitis B virus, HBV. This DNA virus infects liver cells, hepatocytes, triggering inflammation and replication. It spreads through contact with infected blood, semen, vaginal fluids, or from mother to child during birth. Acute HBV resolves in 90-95% of adults, but 5 to 10% develop chronic infection, per WHO, 2023, leading to long-term liver damage. Hepatitis C virus, HCV. This RNA virus also targets hepatocytes, with a 70 to 185% chance of becoming chronic due to its ability to evade the immune system. Transmission occurs primarily through blood exposure, with no vaccine available, making prevention critical. Key risk factors: blood exposure, sharing needles, e.g., in intravenous drug use or unregulated medical settings. Blood transfusions before 1992, when HCV screening began, or hemodialysis increases risk. Seniors who receive transfusions decades ago face a 1 to 2% chance of undiagnosed HCV, CDC, 2023. Contaminated medical equipment in low-resource settings also poses risks. Sexual transmission. HBV spreads through unprotected sex with an infected partner, especially with multiple partners or a history of sexually transmitted infections, increasing risk by 20%. Journal of Infectious Diseases, 2022. HCV sexual transmission is less common but possible in high-risk scenarios. Mother-to-child transmission. HBV transmission during birth carries a 90% risk of chronic infection in infants, meaning some seniors may carry lifelong infections undiagnosed since childhood. Occupational exposure. Healthcare workers or those in high-risk jobs face needle stick injuries with a 30% HBV transmission risk post-exposure if unvaccinated. Occupational medicine, 2022. Seniors who worked in healthcare decades ago may have been exposed. Age and immune decline. After age 60, immune function declines, reducing viral clearance. A 2020 Journal of Geriatric Medicine study found seniors are 20% less likely to resolve acute HBV or HCV naturally, increasing chronicity risk. Comorbidities. Diabetes, obesity, or excessive alcohol use exacerbate liver damage. A 2022 diabetes care study links poor glucose control to a 20% higher risk of cirrhosis in infected seniors, while alcohol accelerates fibrosis by 30. Hepatology, 2021. Genetics. Genetic variations, like IFNL3 gene mutations, reduce HCV clearance by 50% in some individuals. Nature Genetics, 2020, increasing chronic infection risk in seniors. Lifestyle factors. Poor diet, smoking, or lack of exercise weaken liver resilience, with a 2029 nutrient study showing nutrient deficiencies double inflammation in chronic cases. For seniors, these factors often converge, creating a perfect storm for chronic infection and complications. Recognizing these risks enables proactive screening and prevention. Let's move on to identifying the symptoms to catch these infections early. Symptoms of hepatitis B and C, how to spot the signs. Hepatitis B and C often present subtly, especially in seniors, where symptoms may be mistaken for aging, fatigue, or other conditions, delaying diagnosis. Early recognition is vital to prevent progression to cirrhosis or liver cancer. Here's a detailed guide to the symptoms. Acute phase symptoms, weeks to months. Post-infection, fever. A low-grade fever, 38 to 39 degrees, signals the immune system's response to viral invasion, affecting 40% of acute cases. Journal of Viral Hepatitis, 2022. Fatigue, overwhelming tiredness, lasting weeks, stems from liver inflammation, impairing energy metabolism, disrupting daily activities like cooking or walking. Nausea and vomiting. Toxin buildup from impaired liver function causes stomach upset in 50% of acute cases, reducing appetite and causing weight loss. Loss of appetite. Aversion to food, often paired with nausea, leads to unintentional weight loss, noticeable within 1 to 2 months. Abdominal pain. A dull ache or discomfort in the upper right abdomen, where the liver resides, signals inflammation or swelling, affecting 30% of patients. Jaundice. Yellowing of the skin or eyes from bilirubin buildup occurs in 30% of acute HBV cases and 10% of HCV cases, often accompanied by dark urine or pale stools. Dark urine and pale stools. Bilirubin in urine darkens it, while blocked bile lightens stools, indicating liver dysfunction. Chronic phase symptoms, after 6 months. Persistent fatigue, chronic low energy, impacting tasks like gardening or socializing, affects 60% of chronic cases. Liver International, 2021. Joint pain, aching joints from immune complexes, mimicking arthritis, are reported in 20% of chronic patients. Itchy skin, cholestasis, bile flow obstruction causes bile salt buildup, leading to persistent itching, especially at night. Spider angiomas, small, spider-like blood vessels on the skin signal liver dysfunction, visible on the face, chest, or arms. Ascites, fluid buildup in the abdomen causes swelling, a hallmark of advanced cirrhosis, affecting 20% of chronic cases after 10 years. Easy bruising and bleeding, reduced clotting factors from liver damage lead to frequent bruising or nosebleeds. Cognitive changes. Hepatic encephalopathy, in advanced stages, causes confusion, memory lapses, or irritability, impacting 10% of cirrhosis patients. Hepatology, 2023. Seniors may dismiss these as normal aging, with a 2022 Journal of Geriatric Medicine study noting 40% of chronic cases are diagnosed late, reducing treatment efficacy by 25%. If symptoms persist beyond 2 weeks, disrupt sleep, or worsen, consult a healthcare provider immediately. Early detection can halt progression to severe liver damage. Let's explore how these infections are diagnosed. Diagnosis of hepatitis B and C. Confirming the infection. Diagnosing hepatitis B and C requires a meticulous process to confirm the virus, assess liver damage, and guide treatment. Here's a detailed overview of the diagnostic approach. Medical history and physical exam. Doctors review symptoms, fatigue, jaundice, exposure risks, e.g., past transfusions, needle sharing, or travel to high-prevalence areas, and comorbidities like diabetes. Physical exams check for jaundice, abdominal tenderness, liver enlargement, or signs of cirrhosis like spider angiomas. A thorough history helps differentiate viral hepatitis from other liver conditions like fatty liver disease. Blood tests. Hepatitis B. Hepatitis B surface antigen, or HBsAg, detects active infection, acute or chronic. Anti-HBc, core antibody, indicates past exposure. HBV DNA quantifies viral load to assess activity. Positive HBsAg for over 6 months confirms chronic HBV. Hepatitis C. Anti-HCV antibodies screen for exposure. HCV RNA PCR confirms active infection and identifies genotype 1 to 6, guiding treatment. A 2021 Journal of Clinical Virology study notes 95% accuracy for PCR tests. Some liver function tests. Elevated alanine aminotransferase, ALT, and aspartate aminotransferase, AST, indicate liver inflammation. High bilirubin or low albumin suggests impaired liver function. Imaging. Abdominal ultrasound detects liver enlargement, fibrosis, or tumors. CT or MRI scans provide detailed views for advanced damage or cancer screening. A 2022 radiology study reports ultrasound identifies cirrhosis in 80% of cases. Liver biopsy or fibroscan. A biopsy examines liver tissue for inflammation or scarring, though it's less common due to invasiveness. Fibroscan, a non-invasive ultrasound-based test, measures liver stiffness with 90% accuracy for fibrosis staging. Hepatology, 2021. Additional tests. Blood tests rule out co-infections, e.g., HIV, hepatitis A, or other liver diseases, e.g., autoimmune hepatitis, ensuring accurate diagnosis. The diagnostic process typically spans 1 to 2 medical visits, with results guiding treatment plans. Early diagnosis prevents complications like cirrhosis or liver cancer. Let's dive into the treatment options to manage these infections effectively. Treatment options for hepatitis B and C, medical and natural approaches. Managing hepatitis B and C requires a holistic strategy, combining antiviral therapies, lifestyle changes, and preventive measures to suppress the virus, reduce liver inflammation, and prevent complications like cirrhosis or liver cancer. Here's an expansive overview. Medical treatments. Antiviral medications. Hepatitis B, nucleose, TID analogs like tenofovir, disoproxil, fumarate, or entecavir suppress HBV replication, achieving viral suppression in 90% of chronic cases within 12 months. Hepatology, 2021. These are taken long-term to prevent flares and reduce cirrhosis risk by 50%. Hepatitis C. Direct-acting antivirals, DAAs, like sofosbuvir, ledipasvir, or glecaprevir, pibrentasvir, cure a 95-99% of the cases in 8 to 12 weeks, regardless of genotype. New England Journal of Medicine, 2022. DAAs target viral proteins, halting replication with minimal side effects like mild fatigue or headache. Interferon therapy. Pegylated interferon alpha boosts immune response for HBV or early HCV, though its use has declined due to side effects. Flu-like symptoms, depression. It's reserved for specific cases with a 30% response rate. Journal of Viral Hepatitis, 2022. Liver transplant. For end-stage cirrhosis or liver cancer, transplantation replaces the damaged liver, offering an 80% 5-year survival rate. American Journal of Transplantation, 2023. Candidates undergo rigorous evaluation, with recovery taking 612 months. Monitoring and supportive care. Regular blood tests, every 3 to 6 months. Track viral load, liver enzymes, and cancer markers. Alpha-fetoprotein. Ultrasounds every 6 months screen for tumors, critical for chronic HBV/HCV patients. Natural and lifestyle approaches. Dietary adjustments. A liver-friendly diet rich in antioxidants, berries, leafy greens, lean proteins, fish, chicken, and whole grains reduces inflammation. Avoid alcohol, processed foods, and high-fat meals, which stress the liver. A 2022 nutrient study found a Mediterranean diet lowers liver fat by 20% in chronic cases. Exercise. Moderate activity, 150 minutes weekly, e.g., walking, swimming, improves liver function and reduces fatigue by 15%. Journal of Hepatology, 2021. Low-impact exercises like Tai Chi enhance balance, reducing fall risk in seniors. Supplements. Milk thistle, silymarin, protects hepatocytes, with a 2022 nutrients study showing a 20% reduction in ALT levels after 12 weeks. Vitamin E and omega-3 fatty acids from fish oil reduce inflammation, though consult a doctor due to potential interactions. Stress management, meditation, yoga, or mindfulness reduces cortisol, boosting immunity. A 2020 psychosomatic medicine study found mindfulness lowers stress-related inflammation by 15% in chronic liver disease patients. Vaccination. The HPV vaccine, given in 3 doses, is 95% effective in preventing infection. CDC, 2023. No HCV vaccine exists, but HPV vaccination is critical for at-risk seniors. Avoid toxins. Limit exposure to environmental toxins, e.g., pesticides, cleaning chemicals, which burden the liver. Use gloves and ventilation when handling chemicals. A tailored combination, guided by a hepatologist and primary care team, optimizes outcomes. Regular monitoring ensures treatments remain effective. Let's support your liver with a practical meal plan designed for seniors. 7-day meal plan to support liver health for seniors. This 7-day meal plan emphasizes liver detoxifying foods rich in antioxidants, fiber, lean proteins, and anti-inflammatory compounds to reduce liver inflammation, support detoxification, and promote overall wellness. Each meal is simple, senior-friendly, and designed to minimize digestive stress while maximizing nutrient absorption. Portion sizes are tailored for seniors, with adjustments for dietary preferences or restrictions, e.g., low sodium for hypertension. Recipes avoid alcohol, processed sugars, and high-fat foods to protect the liver. Monday, breakfast. Oatmeal with mixed berries and flax seeds. 50-gram rolled oats, 50 grams mixed berries, blueberries, strawberries, 10-gram ground flax seeds, 200 ml water. Cook oats for 10 minutes. Top with berries and flax seeds for antioxidants and omega-3s. Lunch. Grilled salmon with spinach and olive oil salad. 100 gram salmon fillet. 100 gram fresh spinach. 1 TIOB extra virgin olive oil. Squeeze of lemon. Grill salmon at 180 degrees for 12 minutes. Toss salad for a light, anti-inflammatory meal. Snack. 1 small apple. Wash, slice, and eat for fiber and vitamin C to support detoxification. Dinner. Lentil and carrot soup. 100 grams red lentils, 50 grams diced carrots, 1 tea grated ginger, 500 ml low-sodium vegetable broth. Simmer for 30 minutes. Blend slightly for a hearty, liver-friendly dish. Tuesday. Breakfast. Greek yogurt with chia seeds and a drizzle of honey. 150 plain. Greek yogurt, 10 chia seeds, 1 teaspoon raw honey. Mix and let sit for 5 minutes to provide probiotics and anti-inflammatory nutrients. Lunch. Grilled chicken with quinoa and steamed broccoli. 100 gram chicken breast. 50 gram quinoa, 50 gram broccoli, 1 tsp olive oil. Boil quinoa for 15 minutes. Steam broccoli. Grill chicken for a balanced, protein-rich meal. Snack, 10 dry raw walnuts. Eat for healthy fats and antioxidants to reduce liver stress. Dinner, baked cod with asparagus and garlic. 100 gram cod fillet, 50 gram asparagus, 1 clove minced garlic, pinch of black pepper. Bake at 180 degrees for 15 minutes for omega-3s and minimal liver strain. Wednesday. Breakfast. Green smoothie with kale and pineapple. 1 cup kale, 100 g pineapple chunks, 1 teaspoon grated ginger, 200 ml water. Blend for 1 minute for a nutrient-packed, detoxifying drink. Lunch. Turkey and quinoa bowl with mixed greens, 100 g turkey slices, 50 g quinoa, 50 g arugula, 1 tablespoon olive oil. Boil quinoa, toss with greens and turkey for a light, liver-supportive meal. Snack. 1 medium orange. Peel and eat for vitamin C and hydration. Dinner. Vegetable curry with brown rice, 100 g mixed vegetables, zucchini, bell peppers, 50 g brown rice, 1 teaspoon turmeric. Sauté veggies with turmeric. Add cooked rice. Simmer for 20 minutes for anti-inflammatory benefits. Thursday. Breakfast. Scrambled eggs with spinach and cherry tomatoes. 2 eggs, 50 g spinach, 50 g cherry tomatoes. Whisk eggs. Add veggies. Cook on low heat for 5 minutes for protein and antioxidants. Lunch. Tuna salad with cucumber and olive oil. 100 g canned tuna in water. 50 g sliced cucumber. 1 teaspoon olive oil, squeeze of lemon. Mix and chill for 10 minutes for a refreshing, liver-friendly dish. Snack. 50 g fresh cherries. Wash and eat for antioxidants and anti-inflammatory compounds. Dinner. Baked chicken thigh with mashed sweet potato. 100 g skinless chicken thigh. 100 g sweet potato. Splash of almond milk. Bake chicken at 200 degrees for 25 minutes. Mashed potato for beta-carotene and fiber. Friday. Breakfast. Oatmeal with cinnamon and walnuts. 50 g rolled oats, 1 teaspoon cinnamon, 10 g chopped walnuts, 200 ml water. Cook for 10 minutes for a heart and liver healthy start. Lunch. Lean beef stir-fry with bell peppers. 100 g lean beef, 50 g bell peppers, 1 teaspoon low-sodium soy sauce. Stir-fry for 10 minutes for protein and vitamin C. Snack. 1 medium pear. Wash, slice, and eat for fiber and hydration. Dinner. Lentil soup with celery and turmeric. 100 g red lentils. 50 g diced celery. 1 teaspoon turmeric. 500 ml vegetable broth. Simmer for 30 minutes for a detoxifying anti-inflammatory meal. Saturday. Breakfast. Smoothie with spinach, banana, and almond milk. 1 cup spinach, 1 banana, 200 ml unsweetened almond milk. Blend for 1 minute for a nutrient-dense, liver-supportive drink. Lunch. Grilled shrimp with quinoa and mixed veggies. 100 g shrimp, 50 g quinoa, 50 g mixed vegetables. Carrots, zucchini. Grill shrimp for 5 minutes. Boil quinoa for a balanced meal. Snack. 10 g raw almonds. Eat for healthy fats and vitamin E. Dinner. Baked tofu with zucchini and rosemary. 100 g firm tofu, 50 g sliced zucchini, 1 mante rosemary. Bake at 180 degrees for 20 minutes for a plant-based, liver-friendly dish. Sunday. Breakfast. Greek yogurt with mixed berries and chia seeds. 150 plain Greek yogurt, 50 mixed berries, 10 g chia seeds. Mix and let sit for 5 minutes for probiotics and antioxidants. Lunch. Chicken salad with arugula and olive oil. 100 grilled chicken, 50 g arugula, 1 teaspoon olive oil, squeeze of lemon. Toss for a light, nutrient-rich meal. Snack. 50 cherries and 1 small orange. Wash, peel, and eat for a vitamin C boost. Dinner. Baked salmon with roasted Brussels sprouts. 100 g salmon fillet, 50 g Brussels sprouts. Roast at 200 degrees for 20 minutes for omega-3s and fiber to support liver health. This meal plan harnesses antioxidants, berries, turmeric, omega-3s, salmon, walnuts, and fiber, vegetables, grains, to reduce liver inflammation, support detoxification, and promote overall wellness. Adjust portions or ingredients with a dietitian if you have diabetes, kidney issues, or allergies, and avoid alcohol to protect your liver. Real-life stories. Triumph over hepatitis B and C. Real stories of seniors overcoming hepatitis B and C highlight the power of early detection, treatment, and lifestyle changes. Here are 5 inspiring examples. Mr. Thomas, 73, Ohio. Diagnosed with chronic HBV at 70, Thomas struggled with fatigue and abdominal pain that halted his beloved gardening. After starting tenofovir and adopting a liver-friendly diet rich in greens and fish, he reduced his viral load by 80% in 1 year, confirmed by blood tests. Now, he tends his vegetable garden daily, sharing produce with neighbors and inspiring his community with his renewed energy and optimism. Mrs. Ellen, 68, California. Ellen discovered HCV during a routine checkup, with no symptoms initially. Direct-acting antivirals cured her in 12 weeks, and she joined a liver health support group. Today, she leads weekly meetings, encouraging others to get screened, and enjoys painting classes, crediting early detection for her vibrant lifestyle. Mrs. Linda, 70, Texas. Chronic HBV led to early cirrhosis, causing ascites and fatigue that stopped her family gatherings. With entecavir, a low-sodium diet, and gentle yoga, she reversed fluid buildup and regained energy. Linda now hosts family dinners, sharing her journey to motivate others to seek treatment. Mr. David, 71, Florida. Diagnosed with HCV after years of fatigue, David completed a DAA regimen, achieving a cure. Regular walks and a diet of berries and lean proteins restored his stamina, allowing him to resume fishing trips with his grandchildren, a hobby he thought he'd lost forever. Mrs. Susan, 67, Arizona. Susan managed chronic HBV with milk thistle supplements and a Mediterranean diet after noticing itchy skin and joint pain. Her ALT levels dropped by 25% in 6 months, and she now enjoys knitting and community events, feeling healthier and more connected than ever. These stories show that with persistence, medical care, and support, hepatitis B and C can be managed, enabling seniors to reclaim their vitality and joy. Expert insights. Guidance from leading health professionals. Top specialists offer evidence-based advice to guide seniors and caregivers in managing hepatitis B and C effectively. Dr. Anna Lee, hepatologist. Early screening with blood tests can detect HBV or HCV before symptoms worsen. Antivirals like tenofovir for HBV or sofosbuvir for HCV control or cure infections, reducing cirrhosis risk by 50%. Combine with a diet rich in greens and lean proteins for optimal liver health. Dr. Mark Chen, gastroenterologist. Direct-acting antivirals cure 95% of HCV cases in 8 to 12 weeks, even in seniors. Monitor for side effects like fatigue and schedule ultrasounds every 6 months to catch complications early. Stay hydrated and avoid alcohol to protect your liver. Dr. Susan Kim, nutritionist. Incorporate antioxidant-rich foods like berries, turmeric, and spinach to reduce liver inflammation by 20. Limit processed foods and fats, and aim for small, frequent meals to ease digestion, especially for seniors with comorbidities. Dr. James Patel, geriatrician. The HBV vaccine is 95% effective and safe for seniors. For HCV, focus on natural remedies like milk thistle under medical supervision. Regular exercise, like walking, boosts liver function and energy levels in older adults. Dr. Emily Tran, infectious disease specialist. Prevent transmission by avoiding shared razors or needles and using protection during sex. Seniors with diabetes or obesity should monitor blood sugar as it increases liver damage risk by 25%. Collaborate with a hepatologist for personalized care. Dr. Anita Gupta, dietitian. A Mediterranean diet with omega-3s from fish and fiber from whole grains supports liver repair. Supplements like vitamin E can help, but check for interactions with medications like blood thinners. These insights emphasize a multidisciplinary approach, combining medical treatment, nutrition, and lifestyle changes to manage hepatitis effectively. Community resources. a supportive network for seniors and caregivers. Accessing reliable resources empowers seniors and caregivers to manage hepatitis B and C with confidence. Here's a robust network of support. World Health Organization, WHO.int, offers global hepatitis guidelines, awareness campaigns, and fact sheets on HBV/HCV prevention, testing, and treatment. Centers for Disease Control and Prevention, cdc.gov, a hepatitis, provides detailed guides on hepatitis screening, vaccination, and management with senior-specific recommendations. American Liver Foundation, liverfoundation.org, hosts webinars, support groups, and educational materials on liver health, including free resources for seniors. AARP, aarp.org, offers caregiver support through online forums, health workshops, and tips for managing chronic conditions like hepatitis. Local senior centers provide free or low-cost hepatitis screening events, nutrition classes, and exercise programs like Tai Chi to improve mobility and liver health. Telehealth platforms, e.g., Teledoc, connect seniors with hepatologists, nutritionists, or infectious disease specialists via video, ideal for those with mobility challenges. National Institute on Aging, enia.nia.gov, delivers research-based advice on aging, liver health, and caregiving, with tools like meal planners and exercise guides. Hepatitis Foundation, International, hepatitisfoundation.org, offers peer support groups, educational resources, and advocacy for affordable treatment access. YMCA provides affordable, senior-friendly exercise classes like water aerobics or yoga, tailored to support liver health and overall wellness. Local libraries offer free access to health books, DVDs on hepatitis management, and community health talks, fostering education and connection. These resources create a safety net, ensuring seniors and caregivers have access to education, support, and practical tools to navigate hepatitis B and C. Ensuring safe hepatitis management. Managing hepatitis B and C safely requires vigilance to prevent complications and transmission. Here are essential precautions. Monitor symptoms. Seek medical help if fatigue, jaundice, abdominal swelling, or confusion persists beyond 2 weeks or worsens, as these may signal progression to cirrhosis or liver cancer. Avoid alcohol and toxins. Alcohol accelerates liver damage by 30% in chronic cases. Hepatology, 2021. Abstain completely. Limit exposure to pesticides, cleaning chemicals, or cigarette smoke, using gloves and ventilation when necessary. Medication. Interactions. Antivirals or supplements like milk. Thistle may interact with blood thinners, diabetes medications, or statins. Consult a doctor before starting new treatments. Prevent transmission. Avoid sharing needles, razors, or toothbrushes. Use condoms during sex to reduce HBV risk, less critical for HCV. Disinfect surfaces after potential blood exposure. Vaccination. Ensure HBV vaccination, 3 doses, for at-risk seniors or caregivers, as it's 95% effective. CDC, 2023. No HCV vaccine exists, so focus on blood safety. Comorbidity management. Control diabetes or obesity, as they increase liver damage risk by 25%. Monitor blood sugar and maintain a healthy weight with a dietitian's guidance. Regular screening. Schedule blood tests and ultrasounds every 6 to 12 months to monitor viral load and liver health, catching complications early. Adhering to these precautions ensures safe management and protects both seniors and their communities. Psychological and social benefits. Thriving with hepatitis B and C. Managing hepatitis B and C goes beyond physical health. It fosters emotional and social well-being, combating isolation, which affects 40% of seniors. Psycho-oncology, 2021. Preparing liver-friendly meals with family, joining support groups, or participating in community activities like walking clubs or health fairs builds emotional bonds, and uplifts mood. A 2018 Journal of Psychosomatic Research study found that social engagement reduces depression by 25% in older adults with chronic conditions, transforming hepatitis management into a collaborative, joyful experience. Seniors who connect with others while managing their condition report higher life satisfaction, as sharing recipes or stories creates a sense of purpose and belonging. Caregivers can enhance this by organizing group activities or family cooking sessions, fostering a supportive environment that celebrates resilience. Impact on daily life. Living fully with hepatitis B and C. Effective hepatitis management transforms daily life for seniors, restoring vitality and independence. Here's how. Energy and stamina. Reduce fatigue from antiviral therapy, and a healthy diet fuels hobbies like gardening, reading, or crafting, enabling seniors to stay active. Confidence and independence. Controlled symptoms and regular monitoring reduce fears of complications, boosting confidence to travel or socialize. Social connection. Improved health encourages participation in community events, family gatherings, or support groups, combating loneliness. Quality of life. Better sleep, less pain, and improved mood enhance daily joys, from cooking with loved ones to enjoying quiet evenings. Example: Mr. Thomas, 73, from Ohio, once limited by HBV-related fatigue, now tends his garden daily and mentors young gardeners, crediting his antiviral treatment and diet for his renewed vitality. His story inspires others to take charge of their health. Role of caregivers. Essential support for seniors. Caregivers play a pivotal role in helping seniors manage hepatitis B and C, offering practical and emotional support. Here's how they can make a difference. Meal planning. Prepare liver-friendly meals, e.g. salmon greens, tailored to taste, texture, or dietary needs, e.g. low sodium for hypertension. Involve seniors in cooking to boost engagement. Monitoring. Health. Track symptoms like fatigue, jaundice, or swelling, and ensure adherence to medications or appointments. Report changes to doctors promptly. Encouraging activity. Promote gentle exercises like walking or yoga, 30 minutes daily, to enhance liver function and mood. Join seniors in activities to make it fun. Ensuring safety. Maintain hygiene to prevent transmission, e.g. disinfect shared surfaces. Install handrails or clear clutter to reduce fall risks, especially with fatigue or ascites. Emotional support. Listen actively, share positive stories, or join support groups together to reduce isolation. Activities like storytelling or community events lift spirits. Education. Stay informed via resources like the CDC or American Liver Foundation to provide evidence-based care and advocate for screenings or vaccinations. Caregiver support transforms hepatitis management into a shared journey, empowering seniors to thrive with confidence and connection. Take charge of your liver health. Today, hepatitis B and C, if untreated, can lead to devastating outcomes like cirrhosis or liver cancer. But with early screening, modern treatments, and lifestyle changes, seniors can protect their liver and live vibrantly. Start with this 7-day meal plan. Consult a healthcare provider for personalized guidance and share your journey in the comments below to inspire others. Your health is worth fighting for, and you're not alone on this path. Thank you for watching our channel. If you found this video helpful, please give it a like, subscribe, and hit the bell for more health tips to empower your golden years. Have a question or a story to share? Drop it in the comments. We'd love to hear from you. Here's to a healthier, stronger, and more joyful you.